It's actually really common to have both psoriasis and psoriatic arthritis. And so psoriasis, we know like 2 to 3% of the population in the United States has psoriasis, and that's 8 million people. And so of that 8 million, roughly 30% at some point in time will end up developing psoriatic arthritis. And that's why it's really important as us for dermatologists and for patients to kind of be aware that psoriatic arthritis and psoriasis can really go hand in hand. Psoriasis, usually will develop in the 20s, and then roughly 10 years later, it's different for everyone, but roughly 10 years later is when you'll end up developing psoriatic arthritis, or when one might develop psoriatic arthritis. Psoriatic arthritis is basically inflammation of the joints and then the tendons where they insert into bone. And so generally it involves the peripheral joints, so like the hands, the ankles, sometimes the knees, and sometimes the back, but that kind of distinguishes it from osteoarthritis, where it's primarily the knees and the hips. Other symptoms beyond joint pain and psoriatic arthritis can be swelling of the fingers, of the toes. You can have associated eye issues. We call that uveitis, where basically you have inflammation of the eye. Generally with psoriatic arthritis, you'll wake up in the morning and you'll have significant pain, and that can last even longer than an hour. It takes a really long time to get moving. Initially, when we just have a patient with psoriasis and no joint involvement, often we'll treat a little bit more conservatively. We'll start with topicals, generally topical steroids, moisturizers, and then lifestyle modification. However, if someone starts developing joint disease, psoriatic arthritis, we start managing a little bit more aggressively, and in conjunction with our rheumatology colleagues. Talk to your primary care doctor about new and worsening joint pain. Talk to your dermatologist about new and worsening joint pain. And we should all know what to do with that. And we should be referring to our experts in joint disease, and that's our rheumatologists.